Hello everyone. So in today's video we are going to discuss all the questions which was in the paper second, because almost everyone feels that paper 2 is little bit hard, not that much hard, but it's like as compared to first paper, second paper is little bit difficult. Okay. So now discuss all the questions, and in paper 2, as we all know, the questions were from obs, medicine, surgery, ortho, ENT, from these subjects. And PSM, in our paper in first part it comes PSM, so I did not cover any questions of PSM in this question paper. Okay, so here the first, actually what I did now, I put all the highlighted points of that question, and in front of it I wrote the answer. So if you have any problem with so that you all can, I think we should not watch any recall videos, but for satisfaction that in favor of good results, we have to know that how much we are going to score. So if you score 150 in this second paper, if you are scoring 100 marks, it means that in first paper we are already scoring 120 plus marks. So total we are passed with good marks. Yeah. So here, if you calculate that you got 75, 80, or 100 questions correctly, it means that you will definitely pass. Okay, so this video is only for that purpose. Those people or those persons who feel that second paper was very tough and we could not make it out, so for those, please calculate your score from this question paper, and if you got like 100 questions, then it means that you will definitely pass. Okay, so here the first question, which is from the surgery. Here in question it was written that it is mobile, rubbery mass. So our answer is fibroadenoma. In question there is histopathological image also given for the fibroadenoma. Okay. So mobile and rubbery mass on the breast cancer it is there, and the answer is fibroadenoma. Now the second question is 10-year 10-year old female, tem- she had a mastectomy 10 years ago. Now she is feeling heaviness and gradual swelling on the arms. So what it indicates? So in the arms, if there is swelling, then the answer must be lymphangiosarcoma. Okay. Now the third question is man one is not included. This question is one liner which directly came in our question paper. So man one not include. As we all know, man one include PPM, pituitary pancreas parathyroid. PP, sorry, PPPP, pituitary pancreas parathyroid means pheochromocytoma. It not include. So mark please pheochromocytoma. Okay. Now the fourth question, that is treatment for superficial parathyroid gland. So when we have to do the treatment of superficial parathyroid gland, we have to remove that. We have to do the parathyroidectomy. So I was like two, three different teachers videos, and they all mark the superficial parathyroidectomy. So this is the correct answer for fourth question. Now the fifth question, and these are all surgery questions. I first um, cover all the surgery questions. After that medicine. After that obstetrics. After that ENT, optha, and our ortho. Okay. So biliary atresia, there is one child who has biliary atresia, and we have to answer the duration of jaundice, because duration of jaundice in this patient. So for the biliary atresia patient, the rule is 2, as we all during study read that 2 to 2% is there everything. So in this, all the options was 2 weeks, 2 months, 2 years, and 2 hours. These were the four options, and out of those, the correct answer is 2 weeks. And in question, it is neither mentioned that more than 2 weeks or less than 2 weeks. Okay, so 2 weeks is the correct answer. Okay. Now the sixth question, most common complication of ERCP. So for this, I watched I already told you that I watched multiple videos for getting correct answers, because for this also I marked duodenal perforation. I don't know whether it is correct or incorrect, because one teacher said the answer is pancreatitis and one teacher said that answer was duodenal perforation. So hope for the best. So the most common complication for of ERCP is either pancreatitis or either duodenal perforation. So this question is like in doubt. Okay. Now the seventh question. In the question, it is like elevated serum amylase and lipase was there, and what thing we have to be avoided. So that is the question, and for that the answer is administration of 5% dextrose, means we did not give the dextrose to the patient. Okay. So this one is the answer of this question. Now the eighth question, chronic pancreatitis mentioned in the question, and there is Foster's procedure is performed, and most common route of supplemental nutrition was asked in the question. So for that, the answer is total parenteral nutrition. The patient is on TPN. Okay. Now the ninth question, that is congenital anomaly, is given in the chest X-ray. There is one image in which the chest X-ray image is given, and in which in the left side, we see lots of uh, bowels in that area. So that indicates that it is congenital anomaly. And in the question, it asks which congenital anomaly you see. And their fetal movement also decreases, and the child is in respiratory distress. So for this, the right answer is congenital diaphragmatic hernia. Now our 10th question. In this question, what is the question was that the endoscope is performed, and we find that squamocolumnar junction is proximally located, means it came upward. So when the squamocolumnar junction come upward, when there is sliding hernia. Okay, so the correct answer is sliding hernia, and the option was sliding hernia, rolling hernia, and moreover there is, but the correct answer is sliding hernia. Okay, now the 11th question, that is in this question, it is again related to the eclasia cardia or esophageal cancer, in which the dysphagia is mentioned initially to the solid food and later it is on liquid food. So now what we have to perform? So we have to do endoscopy with biopsy. This is the correct answer for this question. Okay. Now then in the 12th question, what is there? There is mucinous ascites is there, extracellular mucin is present, and there is scattered neoplastic epithelial cells were seen. So for this, the options were, first one is the mucinous cyst adenocarcinoma. In first question, it is cyst is mentioned, while in the second option, it is mucinous adenocarcinoma is there. So for this, the correct answer is mucinous adenocarcinoma. Okay. Now the in the 13th question, what is there? So I was obs gyno, obs gyno and surgery both Fmge recall, and in both of these the teacher answered different answer. Okay, so please don't um, take it as, don't think that this one is your correct answer. Please make it in in doubt. Okay, because treatment of choice for condyloma accuminata in the perianal area, there was one image also given in the question paper, and for that they asked the treatment of choice, and we answered like I answered cryotherapy with liquid nitrogen, but our obs gyno teacher answered it trichloroacetic acid. So I'm not counting this mark because I don't know what is the correct answer. That's why. Now the 14th question, that is the lateral boundary of Hasselbalch triangle. So in the Hasselbalch triangle, the lateral boundary is inferior epigastric vessel. This is 100% correct answer. Now for the 15th question, that is incisional hernia. There was one history of the incisional hernia. Now the incision, and on the site of incision there is hernia now developed. Now what is the treatment of that incisional hernia? So we have to do mesh repair, laparoscopy with mesh repair. This is the right answer. Now for the 16th question, neonatal gastroschisis is there, and we have to tell the most appropriate management for that question. So for the neonatal gastroschisis, the best answer is surgical wall repair. That is the closure with wall repair. And options were wait, you have to wait, it will spontaneously regress. These options were out of four, one of the option was that one, and one was the surgical wall repair. So the correct answer is surgical wall repair, closure with wall repair. Okay. Now the in 17th question, there was one image is there in which the omphalocele is there, and we easily identify that image that it is omphalocele. I hope everyone got correct this answer. Now in the 18th question, in image, they mentioned the MCU image, mixed-dating cystourethrograft image is there, and in which they point one part, and we have to say that whether it is bulbar or penile or urethral or membranous part it is, and the answer is bulbar urethra. That is the bulbar urethra is the correct answer, because I also gave that exam, and I uh, saw which point they mark. So they mark the bulbar urethra. Okay, so this is the correct answer. Now in question number 19, chest X-ray image is given and lots of cannonball appearance was seen, and the answer is lung mass. Okay. Now in 20th also there was one image, and we all know the image was the corneal gangrene image was there. So that one answer also correct. Now in 21, pain relieved by rest and walk when the patient have pain, the patient stops and the pain resolves. But again, when he walked, there was again pain in the legs. So which body classification it is? So it is a grade 3 type of classification. Please remember, it is grade 3 type of classification, and this answer is also correct. Now the 22nd question is morbidly obese, and we have to perform. We already performed the cholecystectomy. Now the patient has deep vein thrombosis. Now, how we can see that the thrombosis DVT? So for any, we suggest by reading that question, we found that it is DVT, and for DVT, we always used to do duplex scan. Okay, so the duplex scan is the correct answer for this question. Now in the 23rd question, it was there was one image, and in which from my side, from in one side of the lung, that is totally white outshadow is there. There is no lung marking, nothing was seen there. And the right side is also like little bit normal, but it's not that much black that we can mark its tension pneumothorax. So for my point of view, that answer is collapse. But lots of teachers say different questions because they told us different images, and in which that's why the surgery teacher mentioned the pneumothorax, but radio teacher marked it collapse. Okay, so please don't count this answer also. Now the 24th question is, there was one image in which temporal side of head, they saw we saw one image of the ulcer, and we have to tell that which type of ulcer it is, rolled out or everted or inverted image. So the correct answer for that one is rolled out. I don't remember even I what I marked for this question. Okay. Now for the 25th question, we have to arrange in sequence, and the sequence is of inflammation, that is hemostasis inflammation. So this one is the mnemonic for this question, that is hips, and the answer is hemostasis first. After that, inflammation is there, proliferation and remodeling will be there. Now, one question was there about the sure sign of abdominal dehiscence post-operative. So for that, the answer is serosanguinous discharge from wound, and we already marked this question lots of time that this question is everyone's. This one is for everyone correct, I hope. Now, for the 27th question, that is farmer, and the farmer has ulcers on neck and squamous cell carcinoma, but there was no lymph node involvement is there. So, what strategy we have to perform? So, we have to perform wide local excision with radiation, or we can do graft or flap. Okay, so this one is the right answer for that question. Now, for the MRND, which structure, modified radical neck dissection, which structure is not preserved, or which structure we have to remove? This was the answer. This was the question, which structure we have to remove, है ना? So for that answer we have to for that question we have to mark submandibular gland. We are not going to spare the submandibular gland. Okay, now for the one NCCT head was given, and in that this shape of image, shape of brain is there. In brain, this type of hematoma will be there, and the answer for that is subdural hematoma. This is convex hematoma. Okay. Now for the trials, the highest priority is given to the red color. This we all know, I hope. Now for the 31st question, road traffic accident patient was there, and there is crush injury, and the crepitus is present. For if the crepitus is present, it means that the gas gangrene was there. Okay. Now for the 32 question, severe maxillofacial trauma is there, and what we are going to do, how we are going to manage the patient. So for that, I hope in the question there was option of tracheostomy. I remember tracheostomy option was there, but I don't remember whether cricothyroidotomy was there or not, because I don't know which answer I marked. So if thyroidotomy was there, then it is the correct answer. If tracheostomy was there and there was no cricothyroidotomy, then tracheostomy is the answer. Okay. Sorry, let me drink some water. Now for the 33rd question, seatbelt injury is there, and the question was which is the most common affected organ. So the answer is mesentery, but and if actually I make these questions today only. So I don't remember whether these options are there or not, but I hope these were, because I marked correctly. I know that whether I marked mesentery or hollow viscus. If mesentery was not there, then I definitely marked hollow viscus. But right now I don't remember. I totally confused whether mesentery was there or holoviscus was there. So you guys can comment which like whom situation is like me. Okay, so mesentery and holoviscus is if mesentery was there, then mesentery is the answer. If holoviscus was there, holoviscus is the answer, and holoviscus means small intestine. Okay. Now, solid organ transplantation, higher incidence of rejection is with. So, for this, the answer options were lungs, brain, kidney was there, and one more option was there. So, the answer is correct answer is lungs because lungs have something around 70% chances of organ rejection, higher rejection. That's why. Now the question was 35th question was refeeding syndrome about the refeeding syndrome, and there was electrolyte imbalance was there, and for that which electrolyte imbalance is not seen, that was the questions in the question paper, and for that the options were hypokalemia, hyponatremia, hypochlorite, something like that. So we have to mark the hyperkalemia because hyperkalemia is not seen in refeeding syndrome. Okay. Now the 36th question was RTM patient who is in shock, hypotension, ECG, and no abnormality was seen. On ECG, there was no abnormality seen. X-ray was normal. EFAS negative is there. Heart rate with bradycardia means hypotension, heart rate decrease with bradycardia. If this, because I definitely remember that this is written in the questions, and the answer is neurogenic shock. Okay. Now the 37th question actually it comes under the radio part, but nevertheless, I covered it in this part also because why to write it again in so I will not write this question in the radio side. Okay. So PET scan is done and which substance, active substance we are going to use? We are using 18 fluorine. Okay. Now from this question, medicine will start. So 38th question, medicine will start. I hope you are going to comment in my video that how many questions uh, did you correct from paper 2. Please. Okay, now the 38th question, first question from the medicine. In medicine, it was given that P wave is of 75 beats per minute and QRS 35 beats per minute means both P, means both atria and ventricle are contracting separately. If they are contracting separately means that there it is Stokes-Adams syndrome is there. That is Stokes-Adams syndrome is the answer. Okay, now for the 39th question, muffled heart sound was there, low blood pressure, JVP finding. This is the methyl is given, and for that the answer was absent Y descent because it is seen in the cardiac tamponade, and in cardiac tamponade there is absent Y descent is there. So this is the answer. For you can also remember it by pay tax in which the this A means absolutely present. Okay, please don't remember it's absent. So in pericarditis, Y wave is present. In tamponade, X wave is present. And now do it vice versa. Like in pericarditis, X wave is absent, and in tamponade, Y wave is absent. So here the answer is absent Y descent. Okay. Now for the 40th question. LAD 2, 3 LAD AVF, these LADs were mentioned, and from this we remember that it is inferior wall MI, and for inferior wall MI treatment we have to do primary angioplasty. Okay, please remember primary angioplasty, not the streptokinase. Okay, now the question number 41, narrow QRS tachycardia will be there, means QRS is narrow and tachycardia is there, it means it is PSVT, and for the PSVT the graph is also given in the questions, and for that, we have to mark the adenosine because adenosine is the treatment of the PSVT. Okay. Now for the 42 question, mid-diastolic murmur was there. Next 48 hours, uh, in the next 48 hours, the symptoms got resolved. So what will be the answer? So the answer is TIA because in 48 hours, the symptoms are going to resolve spontaneously without doing any doing any uh, drug therapy or something like that. So the answer is TIA. Okay. Now the 43rd question, that is mitral stenosis, respiratory difficulty will be there, limb edema is there, and pain in the calf region will be there. So for that, the answer is pulmonary edema. Why pulmonary edema? Because mitral stenosis is there. When mitral stenosis is there, the blood gets accumulated in the left atria, and from there it went into the lungs also. And from lungs also means pulmonary edema will develop. And from there, right side also, right side heart failure also happen, and the blood or fluid get accumulated in the right side region. Liver cirrhosis or something like edema will be there, and 10 in the cars also there. So that's why the correct answer is pulmonary edema, not the pulmonary embolism or something like those options. Please remember it carefully. Okay. Now the 44th question, JVP rises with deep inspiration is there. Now in which situation there is no rise with deep inspiration, means in which the Kussmaul sign is not seen. So the Kussmaul sign is not seen in how come? Because Kussmaul sign is seen in, as we remembered, respiratory uh, right ventricular failure and pericarditis, restrictive cardiomyopathy. In this condition, Kussmaul sign is seen. Okay. So for this, the correct answer is Hokam. Okay. Now the 45th question, HIV positive patient was given and Indian ink positive is seen. So whenever Indian ink positive is there, it means that it is definitely cryptococcus. Okay. Now the 46th question, that is lymphocytosis is there and normal sugar with increased protein level will be there. So for this question, I did not remember that in question it is normal sugar is given or sugar level will be increased or decreased. Definitely I don't even remember that like what is in questions. So the for this the answer is viral meningitis. Okay. So that's why I highlighted it, because even I don't remember that this question was correct or wrong, but this question was definitely there. Okay. Now for the 47th question, high dose dexamethasone test was done for test suppression test was done before and after ACTS levels were high. For this, the answer is ectopic source was there. Okay, so this one is also correct. Now, for there was one image of the hand in which the hand first in this position, after that it comes to this position, and it shows asterexis, means flapping uh, movements. Okay, for this condition is seen in hypercarbia, but for this I marked like I'm totally mad, I marked hypothyroidism. So this one is wrong for me, but I hope everyone got it correct and everyone will pass with good marks. Hope for the best. Now for the 49th question, what is there? There is unilateral pulsatile headache is there, exaggerated on eating, and photophobia, phonophobia is there. And whenever we see photophobia, phonophobia is there and unilateral headache is there, we always used to mark migraine is there. Okay. So the correct answer for this question is migraine. Now for the 50th question, the question was curve criteria is given. Like they did not mention the curve criteria, but they mentioned altered sensorium, respiratory rate is 40 per minute, serum creatinine is 1.9 milligram per deciliter, and score was, if all these conditions were there, so the total overall score comes out to be 2. If 2 was there, total score without mentioning anything criteria, then the answer is IPD with IV drug. But if it is score 3, then ICU we have to admit the patient in ICU with IV drugs. Okay. Now for the 51 question, that is there is immobilized patient with calf pain is there. What we have to perform the duplex scan because maybe it is a case of DVT. Okay. For the 52 question, the third post-operative day, respiratory distress is there. So on third post-operative day, the respiratory distress was there. So for this, the answer is pulmonary embolism. So the answer is pulmonary embolism. Okay. Now for the 53 question, hill to shin test was performed and there is problem in hill to shin test. It means the cerebellum is get affected. So for this, the correct answer is cerebellum. So cerebellum is the correct answer. Now for the 54th question, the yellow copious sputum was mentioned in the question and the postural change was there. So what is the differential diagnosis for this? So for this, the diagnosis is bronchiectasis. Please remember it is the answer is bronchiectasis. Now in 58th question, what was mentioned that the spleen was palpable, it enlarged and B cells was seen there and bleeding and petechia is also there. So for that the answer is CML. Now for 59 question, what was mentioned? It mentioned acute rheumatic fever and we have to tell them the drug for acute rheumatic fever and the drug is aspirin. Now for the 60th question, exudative form is there and for no the question was we have to tell the transudative fluid criteria. Okay, so for the transudative fluid there is low protein in pleural fluid, it means the high protein in pleural fluid is not seen, so that's why the correct answer is high protein in pleural fluid. Like we have to rule out which is not seen in transudative. So in transudative we did not see the high protein in pleural fluid, so the correct answer is high protein in pleural fluid. Now for the 61 question, dysphagia for solid more than the liquids and there is cachexia also. So for this condition, we have to perform the upper GI endoscopy. This is the investigation for doing for ecclesia cardia or we can say esophageal cancer. Now, one question was there in diabetes mellitus patient, how much gram of glucose we have to do for the diagnosis. So we have to do the 75 gram glucose we have to perform. Now for 63 question, the question is bradykinesia, tremor and postural instability was there. So what we have to do? We have to so in that question, lots of bodies were mentioned like Lewy bodies for Parkinson, for Alzheimer disease, the body Hirano bodies was also there, tau protein was also there. So for this, the Parkinson disease is the answer, and we have to check the Lewy bodies, and the Lewy body is seen inside it. Okay. Now for the 64th question, that is anti-diabetic drug causes glucose-urea. So which antibiotic drug causes glucose-urea? So for that the answer is SGLT2 drug which cause the glucose-urea, and the correct answer is empagliflozin. The correct answer is empagliflozin. Now for the 65th question, GTCS conversions more than 45 minutes was performed and lorazepam followed by lev. So if the patient has GTCS conversions for more than 45 minutes, status epilepticus we have to check. अच्छा आप बाहर जाके पढ़ लो बाहर. So for this, the GTCS conversions will be performed, and it is more than 45 minutes. Conversions were more than 45 minutes. It means that these conversions are status epilepticus. And for the treatment of status epilepticus, what we have to do? We have to give the lorazepam followed by levetiracetam. Okay. So lorazepam followed by levetiracetam for the status epilepticus. This is the correct answer, LL. Okay. Now for the 66th question, glycated hemoglobin is given and cutoff for controlled diabetes is 7. Please remember, because I marked it 6.5, but they asked about the cutoff for controlled diabetes. They are not telling me for the diagnosis. Did not ask in the question about the diagnosis for diabetes. They asked about the cutoff for controlled diabetes, and the correct answer was 7. Okay. Now for the 67th question, Menon syndrome associated with. So Menon syndrome is associated with parathyroid adenoma. This is one-liner question was there in the question paper. Now for the 68th question, Cohen syndrome was mentioned, and which is not seen in Cohen syndrome, and all options were there like metabolic alkalosis, metabolic acidosis, and two more options were there. So the correct answer is metabolic acidosis is not seen in Cohen syndrome. Okay. Now for the 69th question, that is myasthenia gravis, the drug of choice is, and one option, only one option is there, that is pyridostigmine, because all other option did not match with myasthenia gravis. So we can easily rule out. If anyone don't know the answer, he or she can easily rule out pyridostigmine. Okay. So the correct answer for this question is pyridostigmine. Now for the 70th question, glycated hemoglobin sample test was done, and there were long big options were there, like we have to do the venous capillary, venous blood sample. We have to take the venous blood sample or capillary blood sample. Something these like options were there, and out of those venous we have to take the sample from Venus. This one was the correct answer. I did not remember the whole options, but I remember that Venus one is correct. Okay, and I checked in lots of video also. Even no one remembered. Even not a single teacher did all options, like make all options big one. Okay. Now for the 71 question, the ABG value is calculated. ABG was given, and which value we have to calculate for ABG? Options were CO2, oxygen, and bicarbonate. One more option was there. So the correct answer was bicarbonate. Okay. Now the 72 question. So for this one also, like I did not remember. That's why I marked it like this. Like a road traffic accident patient with the brain contusion was there, and the loss of consciousness was there. So why it happens? Because here I did not remember actually the percentage. So for this, the answer was whichever percentage is least, that one is the answer. If in the option 17% is mentioned, then the answer is 17%. If 45% answer is there, is the least value in percentage, then this one is the answer. Okay. Now 73 question. Situs inversus is there, chronic sinusitis and bronchitis is easily remember. This is the triad of Cartagena syndrome. That's why the answer is Cartagena syndrome. Because here the highlight point is situs inversus is seen in Cartagena syndrome. In one more condition it is seen, but here the answer is Cartagena syndrome. Okay. Now, if the functional expiratory volume by FVC ratio is less than 0.7 or FE1 is less than 80%, then the condition is asthma. Please remember it is asthma, and lots of option was there. I did not remember, but asthma is the correct answer. Now for the 75th question. Hypertension patient on thiazide is there, and fatigue and hypokalemia with potash. So hypokalemia is seen. So which drug prevent the potassium loss? This one was the question, and for this the correct answer is amiloride. So the correct answer is amiloride. Okay. Now, 76th question is there. True about infective endocarditis. How many samples, blood sample collection was there? How many samples we have to collect? And options were like two sample, three sample. There were two options about three samples and two options about two samples. And in two samples, one it mentioned one aerobic and one anaerobic, and in another option it is both aerobic, and another option is both anaerobic, and three samples, one aerobic and two anaerobic. These were the options. And out of this, the correct answer is two samples, one aerobic and one anaerobic we have to take. Okay. Now for the 77th question, that is 37th question, that is hemolytic anemia with dactylitis and chest pain is seen. So the answer for this is tickling crisis. Okay. Now for 78th question, Palmer and Sol please hyperpigmentation is seen. So if because hypersegmentation is seen in that question, so the answer is MSH, not the Milan. Okay. Please see and calculate. So till now, how many scores do you guys have? Please comment below. Okay. Now in the Ops Gyno from 79th question. So in Ops Gyno, approximate 28 or questions was there, 28 or 30. So I covered almost every question. If I forget any questions, please don't then you can add marks for that for yourself. Okay. Now 79 question. 22 weeks married lady was there and there is contraceptive failure. So which how MTP act was performed? So the options were two doctors' opinion were needed, or uh, we have to continue the pregnancy. This one is the fourth option because I remember, because I marked continue pregnancy. That's why it's the fourth option was continue pregnancy, and first option was two doctors' opinion needed, because I almost got confused. But should I mark two opinion or continue pregnant? Then I remembered, oh, I during while studying now, I remember that while studying till 20 weeks we can do contraceptive failure MTP. After that there is no contraceptive failure, because the lady, if she know that the contraceptive failure is there, then she has to decide earlier why she is going to come after 20 weeks. No, now I don't need that child. No, she has to decide before 20 weeks. That's why I marked, if it in question it was 22 weeks or 24 weeks. That's why it is we have to continue the pregnancy. Okay. Now for the 80th question, female mentally retarded is there, and whom consent we are required. So we have to require the guardian consent, not the father. Okay, please remember it. Not the husband, not the husband. We need consent from the guardian. Okay. So now the 81 question, that is MTP Act 2021 is punishable under. So lots of options was there. All options were correct, but this option is incorrect. That one is no need to send monthly records to government hospital. So this one is the correct answer for this question. Now for the 82 female, pregnant female with asthma is there. Which hypertensive drug we have to give? We have to give the oral nifedipine. Okay. Now for 83 question, that is malarial falciparum contraindicated. So which drug is contraindicated in malarial falciparum? That is primaquine is contraindicated. Options were quinine, chloroquine, primaquine, and artemether. So we did not give primaquine. Okay. Sorry, calcium contraindicated, Flimaquine is contraindicated. We can give all other drugs. Okay. Mac Roberts maneuver is failed in shoulder dystocia. Next step is, so for this the correct answer is suprapubic pressure, because I remember Javanelli maneuver I marked that was incorrect, because in this question Mac Roberts maneuver we have to remember that helper is there, because from the teacher Dr. Shakshi Arora ma'am, I learned that we have to go by in series. Like first we have to do help, we have to ask for help, then all these steps we have to perform, and after the McRoberts maneuver, suprapubic pressure we have to give. Okay. Now for the 85th question, that is most common nerve injured. So the most common nerve injured is lateral cutaneous nerve of thigh. The answer is lateral cutaneous nerve of thigh. In question number 86, fainting in supine. The mother has problem during supine position, but she feels better in lateral left position. Okay, so what is why it is this? So it is due to inferior vena cava syndrome. It is due to inferior Inferior vena cava, okay, because it suppresses the inferior vena cava. That's why the answer is inferior vena cava, not the superior vena cava. Okay. Now for the 87th question, Premi Gravida is there. She has labor pains, and at 1 p.m. the vagina vagina is 5 centimeter dilated, and at 4 p.m. it is 6 centimeter. Cervix is 6 centimeter dilated, not the vagina. Cervix is 6 centimeter dilated. So what is the next step? So see, we did not wait. We have to give the artificial rupture of membrane, and then we have to give the oxytocin, and we have to check after 2 hours, every 2 hours, that how much dilation it will be there. Okay. Now for the management of anemia in pregnancy, hemoglobin level is 10 gram. Second trimester में AMBP is there. Now, Anemia Mukt Bharat program, how much tablets we have to give? We have to give the 60 milligram iron and 500 microgram folic acid once a day. Okay. Now, for the 89th question, fifth day of unprotected intercourse, copper IUCD. If the fifth day in unprotected intercourse is there, so what emergency contraceptive we have to give? We have to give the copper IUCD. Okay. Now, for the 90th question, male and female treatment for genital infection. So, for the genital infection, the treatment is we have to give the genital infection treatment to the partner, है ना? So for the treatment of partner, we have to give the treatment to the partner in trichomonas vaginalis. Okay. Lots of teachers give different answer, because in Dharma, the teacher gave the answer candidiasis, because she told that candidiasis have lots of in percentage it gives like 70% protect 70% cases we have to treat in candida. That one she gave the reason. Okay. But for our obs teacher mentioned it trichomonas vaginalis. Okay. Now for the 91 question, cardiovide discharge, it is seen in candidiasis. Now for the 92 question, answer criteria is there, and answer criteria is seen in bacterial vaginosis. Okay. Most common site for genital TB is fallopian tube, that is ampulla. So this one is the correct answer. For the strenuous exercise, involuntary urine was there. So during exercise means stress is there. So stress incontinence is the correct answer for this question. Now, what is the sequence? And the sequence about memogenesis, lactogenesis, galactokinesis, and galactopoiesis. This is the correct sequence. Memogenesis, lactogenesis, galactokinesis, and then galactopoiesis. This one is the sequence. Maternal side placenta is made up of basalis, decidua basalis. Okay. Now for the 97th question, delayed puberty is seen and short stature with primary amenorrhea is seen. It is seen in Turner syndrome. We can easily remember this one. Now for the 98th question, management for Turner syndrome is we have to give the hormone therapy. Okay. All seen in Turner syndrome except. So we did not see mental retardation in Turner syndrome. Okay, for the 100th question, 22-week old primary gravida, marginal placenta is there. So what we have to do? See, it is in 22 weeks, means it is in second trimester. But how when we can confirm that it is low lying placenta, when during third trimester also it shows the marginal placenta, then only it confirms. So we have to reassess with ultrasound at 32 weeks. That is the third trimester. We have to again perform the ultrasound, and then only we can say that it is marginal placenta. Okay. Now for the endometriosis, what is the gold standard treatment? Gold standard investigation, that is the laparoscopy. Okay. For endometriosis, we have to do laparoscopy. For ovarian torsion, what is the management of choice and investigation of choice? Whatever is there. So the answer is ultrasound Doppler. Please remember that for 101 question, different teacher marked different answer, but the correct answer is laparoscopy. Now, for the previous C-section, vaginal delivery can be tried. So, if in which condition vaginal delivery can be tried? This was the questions, and in the options like previous transverse C-section or lower classical C-section. In classical C-section, once it happened, we never go for vaginal delivery. We always used to do C-section, but one option was there, previous transverse C-section. So, in transverse C-section, we can easily perform the vaginal delivery, and more other options are like pre-eclampsia, and one more option is there. In those also we always used to do C-section, not the vaginal delivery. So vaginal delivery only happened in previous transverse C-section. Now for 104 question, uterine universal management. What is the uterine universal management? So the answer was manual replacement of the uterus. Now 105 question, NTD dose at 11 weeks. It means that she is in first trimester, and for first trimester the NTD dose is 50 microgram, not the 300 microgram. Please remember it. Now POPQ classification is based on, what is the point of reference for POP classification? That is the Hyman. Please remember it. Now, 107 question, that is ideal time for nuchal translation. So I remember it like तेरे तेरे मुक्का मार दूंगा है ना. तो nuchal translation means knuckles, means from knuckles I have to punch you. So knuckles were used to go तेरे तेरा. So in 13 weeks, that's how I remember that तेरा. ठीक है. So that's how the answer is 11 to 13 weeks. Now, in low socioeconomic status, recommended screening method is, that is the answer is BI. By this last question, we finish the OBS. Now start with optha. So in optha question, uh, one-liners were there, like blunt trauma, rosette shaped is there. For sealed ulcer, weak is your spring category is the correct answer. If the child has a white pupillary reflex, intraocular mass is there and calcification is there and family history is present, and if he is a child, so the correct answer for this is retinoblastoma. And some said like phlegm intestine image was there, but now I don't remember. So for that also the correct answer is cataract surgery with primary posterior capsulotomy. Now for the next question, that is, so for 113, the night blindness by conjunctival cirrhosis, it is seen in vitamin A. Well, for 114, order of insertion of muscle. So one question was there, and in which they asked about the order of insertion of muscles, and the correct sequence mnemonic is MILS. Means first medial rectus, then inferior, lateral, and then superior oblique muscle is there. So this is the correct answer for that question, and I don't remember whether it is correct for me or not. Now for the 115 question, for NF1, it is autosomal dominant, but in that option, autosomal recessive is written. So that one is not the correct answer. For this, the correct answer is optic nerve glioma. I don't remember the correct answer for this, but neurofibromatosis one is there, and they mentioned like autosomal recessive and autosomal dominant. So for that, the correct answer is also autosomal dominant. Okay. Now for the 116, first line treatment for glaucoma for adult, and the answer is PG analogs, prostaglandin analogs we have to give. Or if the question was like first line anti-glaucoma for adult, then also the correct answer is prostaglandin analogs. For optic neuritis defect, optic nerve is damaged, suddenly painful loss of vision in one eye. One eye means optic nerve involvement is there. TB drug cause vision defect. So the correct answer is ethambutol. Which TB drug cause vision defect? That is ethambutol. Identify image. Image was there, and one forceps is there. I don't remember the exact forceps, but most of the teachers said that it is McPherson forceps is there. Okay. Now the next question is 120. That is bone cut during external DCR. Which bones were in we have to cut during the external rhinostomy. So the answer for that is maxillary and lacrimal. We have to remove the maxillary and lacrimal. Now 121 question, after cataract surgery, decrease vision in a month, and honeycomb appearance and flower petal appearance both were written in the question, and for this the correct answer is CME, cystoid macular edema. This one is the one liner question. Now for the 122, diagnosed with severe no NPD, NPDR was there, and which criteria is not involved. So for this, the 4, 2, 1, this one is the criteria. So we have to rule out those options in which 4 is mentioned, 1 is mentioned, and 2 is mentioned. And the rest of the rest options will be the answer, that is either cotton wool spot or neovascular uh, will be the answer, but I don't remember the exact option for this, so I write it like this only. Now for the 123 question, endophthalmitis will be there, and for this the treatment is pars plana vitrectomy. So this for this the answer is pars plana vitrectomy, which prophylactic we have to give. So we have to clean it with the iodine. 5% provide iodine. Whether it is an option, then it is the correct answer. Now 124 question, most common cause of blindness in child. In child, the most common cause of blindness is vitamin A. Now for the 121, KPs were seen in iridocyclitis. Now for 126, squint diagnosed with esotropia. What we have to do? We have to perform the occlusion therapy. Okay. Now for the 127, orthoptic glasses. First, the mother wants the second opinion, and for the second opinion, no change in treatment will be there. For symptom test is seen in senile cadet. Now from 129, ENT questions will be there, and one audiogram is there in which dip at 2K is there, and for that 2K dip, the answer is autosclerosis. And one more audiogram is there, and in that the audiogram is upright. it means the Meniere's disease will be there. This is the line in the audiogram and which indicate the Meniere's disease. Okay. Now for 131, nose from the nose smell is coming and nasal obstruction is there. For that, the correct answer is atopic rhinitis. And for the adenoid image is there, which type of voice we heard? We heard the rhinorrhea clausa. Okay. For 133 question, Holler Miller sign image was seen and recurrent bleeding is there. So we have to perform tumor vessel lack contractility because the vessels lose the contractility mechanism. That's why. So the source or one more question, if there is source of bleeding, then internal maxillary artery is the correct answer. Seriously, I do not remember. Even I wrote the questions. Even I wrote the answers by myself in the Fmge exam. But now I don't remember that which question was is this answers options will be there or not. But I remember that internal maxillary artery is their option. So source of bleeding is internal maxillary artery. Okay. Now for 134 question, right superior oblique, right as well, serous otitis media is there, unilateral right side serous otitis media is there, and the patient is 50-year-old. That's why the answer is NPC. Okay. For 135, all true except for laryngomalacia. So for laryngomalacia, we never used to perform any surgical management because it is self-resolution will be there. So this is one is the incorrect option, that is surgical management is required in most child. Okay. For 136, repeated infection is there and failure of fusion of there is one sinus is seen in upright side of the ear in front of the ear, and for that the correct answer is first and second mesoderm derived from first and second. Okay. And for one more image is there in which we see in question also it is written that it is teacher no teacher nodule will be there, like teacher vocal cord problem will be there. So in teacher the answer is vocal nodule. Okay. For the 138 question, discharge diabetes and glycated 10 है, HB1 is 10 है, excruciating ear pain है और discharge is there. So for that the correct answer is necrotizing otitis externa. For 139, type of stridor in croup. So in croup the type of stridor is biphasic. And we have to identify the instrument and the instrument image is there. That one is in T shape like this. So for that the correct answer is trachoesophageal prosthesis and the name of the device is there, that is the Bloom singer. Okay. Now external auditory canal trauma will be there. So what we have to perform? We have to keep the eye dry. So we give analgesic, no ear and then audiometry we have to give. Okay. So now for the 142 question, neural crest cell derivative. So for neural crest cell derivative the answer is if they I think they marked some one bone is there, and I think that that one is maybe stapedius or malleus will be there. So answer is if malleus they mark then it is first arc, if stapedius they mark then it is second arc answer. Okay. One image of the brain is there and in which they marked that like this which view it is. So the teachers told that it is Towns view, but I don't remember which I marked, and the line is like this or maybe like this. I don't even remember this one. Okay. Now for the 144 question, most nerve affected after parotid surgery. So after parotid surgery, which nerve gets mostly affected? That is facial nerve. 145 question, bleeding after 2 weeks of surgery when he or she eats chips. So for that, if it happens after 2 weeks, then the answer is antibiotics. We have to give him antibiotics. 146, from here the outsource questions will be start. Father is written in the question like flexion, abduction, and external rotation. These were mentioned in the question. I definitely remember this. So for this, the answer is anterior hip dislocation. For 147 question, gun deformity is the same. For the gun deformity, we have to see the answer is malunion supracondylar fracture of humerus. This one is the correct answer. One teacher said that this one is correct answer. One teacher said this one is the correct answer. I don't know whichever answer is correct, but I am not going to count these marks for myself. Okay. Now for the 148 question, pencil thin cortex is seen, and we know that pencil thin cortex is seen in curvy. For 149 question, this 147, 149 and this one question is from anatomy. So I will cover it in anatomy, but I wrote here, so now I will not cover it in anatomy PDF. Okay. So this one is our only and only second part PDF. So Swas muscle insertion is seen in lesser trochanter. Now bone tumor in finger is there. One image of the hands will be there, and in those in our fingers they say we saw lots of tumors is there. Whenever finger involvement is there, the only and only answer is enchondroma. Please remember it. for NEET PG also, because now we have to give the NEET PG also, no? That's why. Now, wrist diagram, carpal metacarpal joint was there, and for that they asked about the joint, and the option were like hinge joint, saddle joint, two options, ellipsoid joint or something like that was there. So the correct answer is saddle joint. Okay, Ritter syndrome is the name. So for Ritter syndrome, SLA B27 gene involvement is there, and this one is my first question in the second paper. Okay, so now from the anatomy, the tariff anatomy, 147 questions for in perspective of orthopedics, because I wrote here about the anatomy questions. But now for the orthopedic question, the terrible trade of elbow not include. So the answer is fracture of polycranum. They don't include. Now for the right femur swelling intake, there is right side of femur swelling is there, and the patient has history of aspirin intake. So the answer for this is osteoid ostomy. And polyhistory is also there, and right elbow injury is there. So for that, the answer is radial head dislocation. So this one is for the second part of FMG. I hope you all love my this video, and please comment how much score you are going to score in paper 2. Thanks.